hypothalamus. So first is the food intake. So there are two main centers. One is satiety center, other is your hunger center. So satiety center is ventromedial nucleus and hunger center is lateral nucleus. And if there is a lesion of the ventromedial, he will take more and more food, he become obese. And if it is stimulated, he will be already satiety. So there will be decrease in the hunger and patient will be lean and thin. On the other hand, if you damage or there is a lesion of the hunger center, lateral nucleus, he will not feel hungry and decreased food intake will cause him to become lean and thin. And if it is stimulated, he will be always angry, he become obese. So there are two main center, ventromedial for satiety, lateral for hunger, and they work with the chemicals. So the chemicals which decrease hunger is anorexin, and the chemical which increase hunger is called as orexin. So anorexins are the chemical which are decreasing your satiety, decreasing your hunger, or you can say they regulate your satiety. For example, CART. CART means cocaine, amphetamine, regulated transcription factor, and alpha MSH. Orexins are increasing the hunger like neuropeptide and agouti, gene related peptide. Now comes body temperature. We are homeothermic, so temperature is always constant. For that there are two nucleus, one is anterior nucleus, second is posterior nucleus. So you can remember like that, this behave like AC. So it respond to heat. So whenever there is heat outside in the environment, we have sweating, we have vasodilation, and we have thirst, so that temperature remain constant, temperature comes down, so it behave like air condition, you can say. On the other hand, if there is cold outside in the environment, we will shiver, there is a vasoconstriction, increased frequency of urine, and so you can say it behave like a heater, and the lesion will cause hypothermia, and the lesion of the anterior nucleus will cause fever. Now, what is the pathophysiology of fever? So fever is different from hypothermia. We will use the term fever only when set point become high. Hypothermia can be, for example, if you are dancing for 1 hour, temperature will increase and you say hypothermia is there. But fever will be only when set point in the hypothalamus will increase. For example, if there is some infection, what will happen? Prostaglandins will become more, interleukins become more, cytokines become more, and they will go inside the hypothalamus and increase the set point. They increase the set point, leading to vasoconstriction and shivering. That is why you are shivering before temperature comes, before fever comes. So vasoconstriction and fever and shivering in fever are the mechanism of pathophysiology of fever. And when you take paracetamol and NSAID, it will inhibit prostaglandins. Temperature returns to normal by decreasing the set point. Set point become normal now, normal to the temperature, and there is vasodilatation, there is sweating, and that is going to decrease temperature. That is why when there is sweating, temperature start coming down. Now sleep. Sleep is regulated mainly by preoptic nucleus, ventrolateral preoptic nucleus, and wakefulness is the similar nucleus which is for hunger. That is why when we are hungry, we are awake. So when we are hungry, we are always awake. So orexins are the chemical which are causing hunger, So this nucleus is also involved in wakefulness. That is why if there is a mutation or loss of orexin, there is narcolepsy. Narcolepsy is daytime sleepiness. Every time you are feeling sleepy, it's called as narcolepsy. Mammillary body is usually for memory consolidation. So someone is taking chronically alcohol, okay, this lead to thiamine deficiency, and thiamine is required for mammillary body. And if there is chronic alcoholic patient having thiamine deficiency, mammillary body will not function properly, so there will be memory loss leading to confabulation. Confabulation is filling the gap of memory. There will be confusion, there will be ataxia, and this triad is called as Wernicke's-Korsakoff psychosis. And the treatment will be similar, that is thiamine injection. Now it is also important for endocrine regulation by releasing some releasing hormone. For the pituitary, like gonadotropin releasing hormone, growth hormone releasing hormone, corticotropin releasing hormone. They also release some of the inhibitory hormone like growth hormone inhibitory hormone, prolactin inhibitory hormone, which is called as dopamine. Then we have two more nucleus. Supraoptic is mainly for ADH, okay, and paraventricular is mainly for oxytocin. So although both nucleus can form both, but mainly oxytocin is by paraventricular, ADH is by supraoptic, and they also release based on the osmoreceptor, and they are present in the preoptic anterior hypothalamic nucleus. Now dorsomedial nucleus, it is for anger, aggression, jealousy. All those things are because of the DEM. DEM is angry, you can remember like that. Dorsomedial nucleus is for anger, aggression, and usually cortex control this anger. So when there is decortication, cortex is removed, he can have excessive anger called as sham rage. In animals you can see in the form of hissing, and that can be eliminated by ablation of hypothalamus. Then comes suprachiasmatic nucleus. It controls the circadian rhythm, and that is why it is called as biological clock. It is called as biological clock. So suprachiasmatic nucleus controls circadian rhythm. That is why it is called as biological clock. So when sunlight falls on your retina, it goes to suprachiasmatic nucleus, and this is called as external clue. But sometimes it has been seen that even if you remove the external clue, even if it is removed, even then circadian rhythm is not lost. Even then, it means there must be some internal clue as well. Although circadian will increase from 24 to 25 hours. Okay. Now one thing more, ACTH hormone which release cortisol, they are obeying circadian rhythm. They are maximum in the morning, minimum at night, and the reward center is medial forebrain bundle. Nucleus accumbens, dopamine is involved. It is important for addiction behavior. Someone is addicted to the drugs and all, it is all because of dopamine and nucleus accumbens. And sexual behavior is controlled by preoptic nucleus.